How is pancreatic function tested in medical assessments? Have you ever wondered how doctors evaluate the health of the pancreas? Testing pancreatic function is crucial for diagnosing conditions like pancreatitis and pancreatic cancer. The pancreas plays a key role in digestion and hormone production. Medical assessments focus on both its exocrine functions, which involve digestive enzymes, and its endocrine functions, which involve hormones like insulin. To start, laboratory tests are commonly used. Blood tests measure levels of pancreatic enzymes such as amylase and lipase. If these levels are elevated, it may indicate acute pancreatitis or injury to the pancreas. Additionally, blood glucose tests help assess how well the pancreas is regulating blood sugar. Fecal tests are also important. Fecal elastase and fecal fat tests measure the output of pancreatic enzymes in stool. Low levels of fecal elastase can indicate conditions like chronic pancreatitis or pancreatic cancer. Imaging studies play a significant role as well. Ultrasound and computed tomography scans are frequently used to visualize the pancreas and detect any structural abnormalities like tumors or cysts. Computed tomography scans are particularly helpful in staging pancreatic cancer and assessing its extent. Magnetic resonance imaging and magnetic resonance cholangiopancreatography provide detailed images of the pancreatic ducts and surrounding tissues, which can help identify blockages or masses. Endoscopic ultrasound combines endoscopy and ultrasound, allowing for high-resolution images and the possibility of fine needle aspiration biopsy for diagnosis. Specialized functional tests are sometimes utilized too. The secretin stimulation test evaluates the pancreas's ability to secrete digestive enzymes by stimulating it with the secretin hormone. This test measures enzyme output in duodenal fluid collected during endoscopy. Although it provides direct insight into exocrine function, it is less commonly used because of its complexity. The glucose tolerance test assesses endocrine function by measuring blood glucose response after glucose intake, helping to detect diabetes related to pancreatic dysfunction. Emerging approaches include blood biomarkers and genetic testing, which may help identify risks for pancreatic cancer or autoimmune pancreatitis. Artificial intelligence tools are also being integrated into imaging to improve accuracy in detecting pancreatic conditions. In clinical practice, the choice of tests depends on the symptoms presented and the suspected diagnosis. For instance, unexplained weight loss, new-onset diabetes, or abdominal pain may lead to blood tests and imaging to rule out serious conditions. Early detection is vital, especially for pancreatic cancer, which often has a late presentation and poor prognosis. Therefore, screening programs for high-risk populations may include blood tests and imaging to facilitate earlier diagnosis. Overall, testing pancreatic function involves a combination of laboratory assays, imaging techniques, and sometimes direct functional tests. If you have symptoms or risk factors for pancreatic disorders, consulting a healthcare professional is essential to tailor testing to your needs.